Grading of fibrillation potential and positive sharp wave reproducible increased insertional activity or sparse fibrillation potential or positive sharp wave more noticeable spontaneous activity in more than two different sites in a muscle. Grade 1 is reproducible increased insertional activity. Grade 2 is noticeable spontaneous activity in more than two different sites in a muscle. 3 is abundant spontaneous activity regardless of the position of the needle. Abundant spontaneous activity. 4 is marked fibrillation potential and positive sharp waves that fill the screen. Positive sharp waves that fill the screen. Positive sharp wave that fill the screen. Grade 4 fall interference pattern of potential. Grade 3 many potential in all area. Grade 2 moderate number of potential in 3 or more area. Grade 1 persistent single train of potential more than 2 to 3 seconds in at least 2 area. None present. Grading depending on the length of the nerve between the muscle being studied and the site of the lesion. Lesion of the L5S1 nerve root, longest nerve in the body. Fibrillation potential and positive sharp wave first appear in 10 to 14 days in the paraspinal muscles, 2 to 3 weeks in the proximal thigh, 3 to 4 weeks in the leg, 5 to 6 weeks in the distal leg and foot. Lesion in the distal nerve near neuromuscular junction, the shortest possible distance between a lesion and the muscle as occurs in botulism. Fibrillation potential and positive sharp wave first appear in few days. Complex repetitive discharges. Complex repetitive discharges, depolarization of single muscle fiber followed by apathic spread to adjacent denervated fibers. Complex repetitive discharges characteristic may take any form, but form is constant from one potential complex to next. Rhythm is regular. Frequency is 10 to 100 Hz. Amplitude is 50 to 1000 microvolt. Stability abrupt onset and cessation observed in myopathy, polymyositis, limb girdle dystrophy, myxedema, Schwartz-Jampel syndrome, neuropathies, poliomyelitis, spinal muscular atrophy, amyotrophic lateral sclerosis, hereditary neuropathy, chronic neuropathy, carpal tunnel syndrome, iliopsoas, biceps brachii, heavy machinery or idling motorcycle produced by the firing of CRD, complex repetitive discharges, start and stop abruptly, nerve block and curare do not abolish complex repetitive discharges, suggesting the origin of this potential within the muscle tissue. Heavy mechanism, start and stop abruptly. Complex repetitive discharges, heavy machinery or idling motorcycle produced by firing of complex repetitive discharges, start and stop abruptly, nerve block and